The pharmacodynamics is yet to be got understood more deeply, and we give insulin with it. By giving insulin, we are not stimulating pancreas. See, there is a horse, right? It's already dying. If it hit to run more faster, will it run? No. Sometimes it needs rest. So prescribing insulin will give rest to the pancreas. Sometimes the pancreas, insulin, the islets of pancreas, they make beta cells of pancreas, they may get regenerate. So my dear friends, if you have diabetes, don't get panicked. Just follow the instructions which I told you. Go to your doctor. And if you don't have diabetes, see, by virtue we are prone for diabetes. Please follow my dietary things which I told you and lifestyle modifications to be safe from the risk of diabetes. Now we will move on to hypertension. What is hypertension? See, hypertension is a disease where the blood pressure is more than 140/90. Normal blood pressure, systolic ranges from 90 to 120, diastolic ranges from 60 to 80. When the blood pressure, what is blood pressure? It's when the blood moves in the blood vessels. Like you just think of the blood vessels, there are pipes, okay? Heart is a pump. When the blood is forced in the blood vessels, when it is forced, it will cause a friction. It will bulge. It will make the vessel to bulge. So that is the pressure of blood over the blood vessels. So what are the main? So that is the pressure. That is the blood pressure. So more than 140/90, it is a clear-cut indication that you are probably hypertensive. What are the causes of hypertension? Why do people are getting hypertension? See, most of the times reasons are unknown. Most of the time, why we get hypertension? The reasons are what we tell. These are familial or these are genetical or acquired, which we can't still understand. To simplify the hypertension, think like this. So heart is a pump, okay? It's pumping the blood at a very high pressure. So what will happen to the blood vessels? Blood vessels, they will have a elasticity. They will expand and they will become small. They will expand, they will become small. They will expand. When it is 120, they are expanding, and when it is 80, they are just coming down. So there is one extension potentiality, like for all the elastic things, like whatever we have elastics, if you pull them and if we leave them, we will stretch and we will leave. We will stretch when we leave. So it will have some amount of thing which can play with it. If the blood pressure goes more, if I take an elastic thing and if I pull it or if I stretch it for a longer duration, for a longer time, what will happen? It will lose its elasticity. Once it loses its elasticity, it will try to become hard. Once it becomes hard, so it will give resistance to the blood. Once it gives resistance to the blood flow, the heart will have to push more against the resistance. There will be a cardiac hypertrophy. There is blood vessels are getting rigid and heart is pumping more against the blood vessels. So what will happen? See, there are again, we will come to the small blood vessels in the eyes, retina, in the periphery, in kidneys, in the brain, where we have very small blood vessels. If I push on a road like a state highway, if I get a bulldozer at 120 kilometers, what will happen to the road? Same thing will happen. There will be loss of elasticity elasticity of the blood vessels and the brain, retina, kidney, periphery, where either they will get bulged out and they will bleed, or they will get obscured and obstructed. So obstruction will cause there won't be any blood flow further. Once there is no blood flow further from the obstructed blood vessel distally, the distal thing will get suffocated and it will die. So that will cause infarct, ischemia. Infarct, ischemia is there will be some amount of death in the cells. So that's about the velocity. That's how the diabetes, that's how the hypertension will cause end organ damage. Okay, doctor, you told that hypertension is idiopathic. Most of the times it is idiopathic. We don't know the cause for it. It comes. What are the risk factors? I think the risk factors are the stressful life, smoking, our lifestyle. These are the most common causes for hypertension. So what are how better we can avoid, how better I can be safe from hypertension? Get regular checkup. What WHO website says, the worldwide, one male person out of 4 person is hypertensive, and one among 4 males is hypertensive, and 1 among every 5 women is hypertensive. So reason for hypertension is our lifestyle and eating habits. What are our eating habits? Taking salt more, consuming more consumption of salt is one of the main cause for hypertension. So less consumption of salt, less than 5 grams per day. Eating more balanced green leafy vegetable diet with less fat, less trans fats is definitely beneficial, and it will protect us from the hypertension. And again, what I told you, God has given us 24 hours, 8 hours to work, 8 hours to rest, and 8 hours to be with family and society. So once we follow this, the chances, the risk of hypertension, of getting hypertension will get reduced. So eating less salt, eating less fats, saturated fats, these are the things which will protect us from the hypertension. You will be thinking, doctor, what fat do with the hypertension? See, why do we need fat? So sugar we need to keep ourselves alive. Okay, when I am sleeping, there will be consumption of, we will be burning our sugars by oxygen to keep ourselves alive, to maintain our temperature, to respirate, to our heart to beat. We need some amount of energy. So that will come from the glucose. So where do we get? Where do we get? What is the need of fat? See, my face, it's glowing. Okay, right? There is one layer of fat over my face, skin. So whatever, even the rain falls, my skin will be protected against the water. So everywhere there is a fat layer. God created everywhere. Fat is like a layer. It's a membrane God has given us. So we need fatty acids to keep those membranes, to regulate those membranes. If we eat more fat, what will happen? We will get more thicker fatty layers. So more thicker fatty layers in the blood vessels. So wow, the blood vessels, the more thicker the fatty layers, so those will decrease the lumen. They will decrease the lumen of the blood vessels. Definitely there will be decreased lumen. The blood flow will be obstructed. Once there is a blood flow will be obstruction, the heart will push it more strongly. Once heart pushes it more strongly, the more it pushes strongly, the blood vessels will lose more of its elasticity, and more we will get to prone for the end organ damage like stroke, the cardiac arrest. The blood vessels of the heart will get blocked, and we will get the cardiac arrest, cardiac heart attacks. So to summarize, friends, diabetes and hypertension has two risk factors, non-modifiable, modifiable. Modifiable risk factors are the things which we can control. So for both the diseases, the modifiable risks are almost same. Physical exercise, meditation, stressless life, a proper balanced diet will keep us secure away from both these diseases. Okay, if I get both diseases, what shall I do? Don't worry, go to your neurologist doctor. He will measure your BP. It's a non-invasive simple technique. He will mount a cuff around your arm and he will check your blood pressures, non-invasive blood pressures. And if it is more, he will prescribe medication. He will keep the blood pressure low so that your end organs will be protected. You will have a more productive life. So diabetes and hypertension is like other diseases. If we should not get them. We should modify our lifestyles. We should modify our eating habits to safeguard from those diseases. If we get them, we should learn to live with them, to consult your nearest doctor, to take regular checkups, to get medications properly, to trust your doctor. Okay, that's for today. We will meet next week with new different topic. I will be again and again coming to you and bothering you and disturbing you with the new things. These are not new things. Like these are not anything new. This is the most common things which a patient should know. I will tell you, dear friends, a patient should know more about the disease than the doctor. Then he will lead a happy, fruitful, productive life. Thank you everyone. Good night. Jai Hind.